Hey everybody, and welcome back to another video here at Whiteboard Medicine. We appreciate you checking it out. Hope everybody is having a decent week so far. What day is it today? It's almost the weekend, although it's not very relevant for us in healthcare, work weekends and weekdays and what have you. But hope everyone's having a good week, and those that don't work on the weekends, you're almost there. Today we are diving into a topic requested by you all. We always appreciate when you request topics. We've been trying to do more topics that y'all have requested, and we're kind of gathering topics too, and maybe we'll do a live video sometime where we answer some of these questions live. So certainly keep putting in requests, and today we're diving into the Hantavirus. This has risen, it comes up every now and again, a couple times a year, but it's risen to unfortunate fame after Gene Hackman's wife died from hantavirus. So we're going to be learning about all things hantavirus today. We'll talk about cases of hantavirus, current and past, where it was first discovered, how often we see it both in the States and in Europe. We'll talk about what it is, its virology, its rodent reservoirs. We'll talk about how it infects humans and how it causes disease, how you can catch it, its incubation period, symptoms, including both the Hantavirus Cardiopulmonary Syndrome, one of the diseases, the Hemorrhagic Fever with Renal Syndrome, the other type of disease. We'll talk about how to treat those both, diagnose, prevent it, and more. So this is going to be a deep dive into all things hantavirus. Again, it comes up both in the United States and worldwide. It's important to know about. And it rose to unfortunate fame because of Gene Hackman's wife. For those of you new to this channel, this is the channel Whiteboard Medicine. We are a public health and medical education channel. We'll link in the video description tons of different playlists and videos, so definitely check those out. Subscribe, hit the bell button. We'd love to have you. We also will link our Patreon page. You can join this page for free. Membership is free. There are certainly also paid memberships, and if you have the desire and means and you want to support the channel in that way, we of course would love that too. But even if you just want to join for free, we post almost daily or every other day. That's where we kind of do our live updates on all things public health, medical education, practice questions, ad-free videos, kind of behind the scenes stuff, video outlines, and a lot more. So definitely check that out if it's something you're interested in. We'd love to have you there. No further ado, quick 30-second break for introduction. Don't go anywhere. We will dive into the video right when we're back. Everybody, and welcome to Whiteboard Medicine. We appreciate you checking out the video. Here at Whiteboard Medicine, our goal is to create medical education content for all types of interested learners. That includes videos, practice questions, study resources, and much more. We would love for you to join our community by subscribing, hit that bell button. We're also working to build a high-yield Patreon page. It's going to be full of practice questions, video outlines, notes, commercial-free content, and much more.
None of these videos are intended to be acted upon as medical advice. Please pause.
All right, thanks for sticking around. So hantavirus, a little bit of a haunting name, although the origin of the name, which we'll talk about, was not because it is haunting. It was related to geography, as is so often the case. Anyone interested, this picture over to the right here is electron microscopy of one of the hantaviruses. So it's a zoomed in picture. Each one of these are kind of little virus virions. So it's kind of amazing that these little tiny viruses can make us so sick. So no further ado, the first thing we're going to talk about is kind of cases and some of the news headlines. So breaking news the other day or week, depending on when you watch this, is unfortunately Gene Hackman's wife, Betsy Arakawa, died from hantavirus, particularly Hantavirus Pulmonary Syndrome, known as Hantavirus Cardiopulmonary Syndrome and also Hantavirus Pulmonary Syndrome. And this is a really deadly disease you can get from hantavirus. And obviously Gene Hackman, being a celebrity, and his wife unfortunately succumbing to this disease, brought hantavirus under the spotlight. But it was also timely because we're starting to see a few other cases popping up in California, Mammoth Lake, where 2 individuals have recently died from hantavirus. And we see a couple of outbreaks a year, particularly in the southwest of the country. Again, something we'll talk about. Anyone interested in origin stories and why things are named the way they are? We just want to do a quick shout out. Obviously, hantavirus in our mind sounds haunting, but the reason it's named that is in 1978 when it was first discovered in South Korea. It was discovered near the Hantan River, hence hantavirus. All right, cases. In the US, surveillance actually began in 1993 for hantavirus. And this was when it was first detected in somewhere called the Four Corners region. And that's kind of where Utah, Colorado, New Mexico, and Arizona all come together. called the Four Corners region. And a very astute clinician at the hospital noticed this cluster of young-ish folks without a lot of medical comorbidities that all seem to be getting this terrible disease. What we now know is Hantavirus Cardiopulmonary Syndrome, and many of them died from it. And this physician said, "This is bizarre. This is anything like I've seen." And they took samples from those patients and tested them, and they discovered this kind of new virus, at least for this area, known as hantavirus. And we'll talk about hantavirus as actually an umbrella term for a bunch of different viruses, but that's something we'll talk about in a bit. So back in 1993 is when surveillance began. And this map from the CDC tracks cumulative cases by state. It goes only through 2022, a little outdated, but still informative, we think. So 1993 to 2022, there's been 864 confirmed cases of hantavirus in the USA. The age range has been vast. Anyone 5 years old is the youngest, all the way up to 88 years old, YO years old. Median age being 38, so it affects the young, it affects the old, but the majority of folks are kind of middle-aged, which is important, right? Because again, this is a very deadly virus, and it's there's many viruses that make the really young and really old quite sick, but there's fewer viruses that make kind of the quote-unquote healthy middle-aged quite sick. The mortality rate, and this is specific to the US, because we're going to talk about how hantavirus can cause a few different diseases, but the mortality rate in the US is 35%. So more than a third of people that get hantavirus die from it. Obviously really significant, really severe, especially when the majority of those people are kind of the middle-aged, young-ish, and healthy people. 95% of the cases occur west of the Mississippi, and you can see that here, the CDC map. This is a map we took from their website. It's their map. Cases of hantavirus. The dark color is greater than 50. The light color is only 1 to 15. And you can see the vast majority of places east of the Mississippi are in single digits, right? Minnesota, 2 cases. Wisconsin, 5 cases. Michigan, 2 cases. Illinois, 6 cases, etc., etc. So northeast, east coast, southeast, Midwest, very few cases. When we get west of the Mississippi, remember we said it was first discovered in the Four Corners region, right here? I shouldn't say first discovered, but it was first kind of noticed in the US in this region. These states have lots is relative, but of the states that have hantavirus have lots of cases comparatively. New Mexico, 122 cases, Colorado, 119 cases, Arizona, 86, California, 78, Texas, 49, Washington, 59. So this whole western side, whether it's the Southwest, the West Coast, the Pacific Northwest, all these have a lot more cases of hantavirus compared to the East Coast, which is mostly going to be dependent on the species that are the reservoir for the virus, again, which we'll talk about. We want to do a shout out to the international situation for hantavirus because it's a lot different, right? So we said that in the US since 1993, so total 1993 all the way to 2022, there's been 864 cases. In the EU, though, just in 2023 alone, there was almost 2,000 cases. And this is a lot lower than previous years. You know, many years recently, there's been more than 4,000 cases. The majority of these cases are in Finland and Germany. This, as we said, this 1,800 is the lowest number of cases in several years. Again, most being around 4,000 cases per year. The type of hantavirus disease, though, remember we said in the US, and we're going to talk more about this, so don't worry about remembering it now, but Hantavirus Cardiopulmonary Syndrome, also known as Hantavirus Pulmonary Syndrome, this is what is often happening in the US, but hantavirus can cause another type of disease called hemorrhagic fever with renal syndrome. Hemorrhagic fever with renal syndrome. And this is most of the disease that they see in Europe. So this is a slightly different type of disease, mostly because the hantavirus in Europe is different than the hantavirus in the US. But you can see here, this is number of cases based on population. Darker colors mean more cases, and you can see dark colors up here, some dark colors here. But Finland and Germany, most cases, even though Germany is not dark in color, it's just because their population is quite large, so it's a smaller percent of their population, but lots and lots of cases in Europe of hantavirus. So what is hantavirus? Virology, reservoirs. So hantavirus is actually a collection, a group of almost 30 different distinct species of viruses, all within this family of Hantaviridae. So they're all closely related, but they are all also different. And this is why the USA has a certain type of hantavirus disease. The EU has a certain type of hantavirus disease. We didn't go into it, but South America has a certain type of hantavirus disease. Even within the US, there's different subtypes of hantavirus. The worst one, the one that causes the most sickness, and the one that often is causing that high mortality rate in the southwest of the US is this C. nombre virus within the hantavirus family. So we don't often call it its individual name, we just call it hantavirus, but C. nombre is one of these 30 distinct species of hantavirus within the Hantaviridae family. It is a zoonotic virus, which means that its reservoir is animals, particularly rodents, and we'll talk more about that. And it is for those who are interested, it is a single-stranded RNA virus, RNA ribonucleic acid. This is the genetic code of the virus. And here's another electron microscopy picture. Again, all these little viruses floating around. This is what they look like, spherical shapes with their genetic material on the inside. So we said it's zoonotic, and we said its reservoir is rodents. This means that the hantavirus lives within rodents, and that's kind of what keeps the hantavirus alive. It intermittently jumps into humans, but it spreads within rodents. And different rodents have different species of hantavirus and cause different disease. And some of this is geographically based. This is the CDC's work. Definitely, if you search it, it will pop up. This is not our graphic. But you can see here, and these words are small, I'm just going to read some of the highlights. In North America, certain kinds of mice and rats can spread hantavirus that causes Hantavirus Pulmonary Syndrome. This includes the deer mouse, the white-footed mouse, the rice rat, and the cotton rat, which we'll talk more about. It's hard to tell if a mouse or rat is infected with hantavirus just by looking at it, so best to avoid cleanup droppings, blah, blah, blah. We'll talk more about that. It does go on to say dogs and cats cannot get sick from hantavirus infection or spread hantavirus to humans. So your cats and dogs, luckily, are spared. So these are two of the rodents mentioned. So the deer mouse, which is really all over the US and Canada, but it has a particular predilection to this area in the southwest when there's the most types of illness. And this is what it looks like. So the deer mouse, the rice rat they talked about, this one is really in the southeast of the US, and cases here are quite low. Now, some of these southeast states don't report, but cases here are quite low. So the rice rat can carry hantavirus, but it's not really spreading to humans all that much compared to the deer mouse. In addition to that, we mentioned the two other ones were the cotton rat, also seen in kind of the southwest and south. Texas does have a fair number of cases. Some of those are from the cotton rat, but again, this southeast, sorry, we said southwest before, but the southeast area does not have a lot of cases, so the cotton rat, not a huge deal. And then the white-footed mouse, you can see here in the blue. Again, this is more kind of Midwest, Northeast, Southeast, where there's not a ton of cases, but this is how you can get it in all of these areas. So if you look at our map, there's really several different rodents that are located in different areas all throughout the country, which means you can get hantavirus anywhere, which is why that US map, although cases are most dense over here, you can get it in any state in the US. So everybody, unfortunately, could come run into hantavirus and get infected. Again, not common, but possible. So how does it make you sick? Well, this here is a blood vessel, right? And blood vessels are lined with cells called endothelial cells, just the name of the cells that line the blood vessels. And what hantavirus does is the virus gets into your blood vessels and it starts traveling around the body. And what happens is it has a tropism, meaning a predilection for the human vascular endothelium. So it infects your endothelial cells and causes damage, particularly in the heart, the lungs, the kidneys, and then it travels to the lymphoid tissues. So we're going to talk about this, but what happens is, that's a lung, that's your windpipe into your bronchi, that's your other lung. You breathe in the hantavirus, most commonly. It gets into your lung tissue, and then it starts to invade into these blood vessels, spread throughout the body. and cause damage to the heart, the lungs, the kidneys, all the vasculature, gets into the lymph tissue. So we'll talk more about that. But yeah, it's got this vascular endothelial predilection. It likes to infect the cells of the blood vessels that line them, which stinks, right? Because there's obviously blood vessels all throughout our body. So it kind of can spread everywhere. So how do you transmit it? And what's the incubation period? How do we get hantavirus? Well, as we mentioned, it comes from rodents. We talked about the 4 different species, 2 mice, 2 rats, throughout the US that can spread it. And when a rodent has hantavirus, right, because it's that reservoir, it has a reservoir for hantavirus. The hantavirus gets into the rodent's saliva, into their feces, into their urine, and the vast majority of humans inhale one of these. Some feces, some urine, some saliva, some bedding. Right? You have rodents in your home or you're cleaning something out and you stir up their bedding, covering their saliva and feces and urine. It gets into the air and you breathe it in. And that's how the vast majority of humans get hantavirus. Most people who have had it report exposure to a rodent infested space. So it's very uncommon to just get hantavirus and not have an exposure you remember. You know, maybe you're cleaning something out and there's a bunch of, signs of rodents, or your work involves you going into kind of rodent-infested areas. So it's not common for someone to go, yeah, I don't remember. Maybe it was just a little rodent that was running around somewhere that I never saw. So your exposure usually has to be pretty robust. Not always, but usually. And there's a myth out there that you have to get bitten by the rodent. Very, very few people that get hantavirus report being bitten. Now, being bitten is a risk, right? Because it's in the rodent's saliva. But very few people seem to get it that way. Most people inhale it from a large exposure. There is no widespread human-to-human transmission. So if a human has hantavirus, they got it from a mouse. It's not like one human can give it to another human. This is good, right? Because human-to-human transmission allows things to spread pretty rapidly in the human population because we live in density. But this does not happen. Now, there is one small exception. We said hantavirus is more than 30 different viral species. There is one viral species of hantavirus called the Andes virus that maybe can spread human to human, although even this is somewhat debated. After you get hantavirus, how long is it in your system before you start to have symptoms? What's the incubation period? Well, the incubation period depends a little bit on which hantavirus you catch, but most of the time it's about 2 to 4 weeks. So the incubation period is quite long. This is not 1 to 2 days and then you start to get sick. This is 2 to 4 weeks. So you might have been cleaning out a crawl space, found a bunch of signs of rodents, and then 4 weeks later you get sick and it's hantavirus when you don't even remember that you were cleaning that area out. It can be as long as 8 weeks have been reported and as early as 1 week. And we'll talk a little bit more about this for the most common types of hantavirus, but kind of a long incubation period compared to a lot of different viruses. All right, what about symptoms and treatment? This is the bread and butter. So the 2 big diseases that hantavirus causes. The first one is Hantavirus Cardiopulmonary Syndrome, also known as HCPS or HPS. And this is most often caused by that hantavirus called C. nombre, the one that is circulating mostly in the southeast of the USA. And it causes 5 different phases of illness. And it can stop progressing at any of these phases, right? So some people don't get that sick, but many people do. The first phase is the incubation phase. Makes sense. As we talked about, the incubation phase, median for the C. nombre virus that causes this is 14 to 17 days, right? It's like 2 to 3 weeks. It has been seen as long as, more than 4 weeks. And it's been seen as early as kind of 1 week. So again, if you get it 4 weeks later, you might not even really remember that you were in that crawl space with all the rodent droppings. This is from a study that is kind of the best evidence, but people have reported it anywhere from 1 to 8 weeks. So again, 2 months ago, you could have caught the virus and it was in your body kind of circulating for 8 weeks before it started to cause disease has been reported. After that incubation phase, you start to get sick. You start to have symptoms, right? You go into this prodromal or febrile phase. And this is where you start to get some non-specific symptoms. That could be any illness, right? You start to get fevers, chills, severe muscle aches. And this is something that sticks out sometimes as people report really bad muscle aches, myalgias. And this usually lasts for about a week, 2 to 8 days. It sometimes progresses and worsens, and you start to get abdominal pain, vomiting, diarrhea. Some people say that could be mistaken for an acute abdomen, which is where you have really bad abdominal tenderness that makes physicians or your care team think that you have a terrible thing going on in your abdomen, like appendicitis or diverticulitis, where really you have hantavirus. Obviously, if you have abdominal pain, you're unlikely to have hantavirus because it's very rare, but it can cause this kind of acute abdomen when it starts to get bad. Now, since these symptoms are generic, some things to note is it's very uncommon. You don't often get rhinorrhea or coryza, which is kind of congestion and runny nose. You don't often get that. You don't often get a sore throat, and you don't often get ear pain. A lot of these symptoms are usually part of these generic viral symptoms, so it's sometimes nice to know that these are uncommon. You usually get fever, chills, and severe muscle aches, maybe some abdominal symptoms. At some point during this phase, if you're going to progress to the cardiopulmonary phase, which is the really severe phase, you start to get a terrible cough. And that cough can be the sign that you are progressing to this cardiopulmonary phase. And this is the severe phase. This is the phase where a lot of people die. Because that hantavirus, as we said, likes the blood vessel walls, and it starts to damage them. And it damages them all over the body, but including the lung. And when those lung blood vessels get damaged, fluid starts to leak out into the lung. And as we've talked about in the past, the lung is full of alveoli. These are like little thin-walled balloons. And when they fill with fluid, they collapse, get damaged, get inflammation, and they can't exchange gas anymore. You can't get oxygen into your body and carbon dioxide out of your body. And you start to get heart damage. You can go into shock where you have low blood pressure. You get end organ injury. Your blood can get too thin. You get coagulopathy. You can have abnormal heart rhythms. And this can lead to death. All right? And this can progress rapidly, 2 to 7 days. If you survive, you go into this oliguric phase. Oliguria means low urine output, where you're not urinating as much. So if you survive this phase, all of a sudden you stop urinating, and then if you continue to survive, you go into this diuretic phase, where you start to have huge amounts of urine output. You start to pee a ton. And then the convalescent phase, this is the recovery phase, and it's variable. Sometimes you can recover really quickly. Sometimes it can take weeks or months to recover. But this phase right here, this cardiopulmonary phase, this is where people die. Remember, we said the mortality rate in general is about 35%, even a little higher if you have the C. nombre version of hantavirus. But this is why people die, right? Because all the damage to that blood vessel starts to lead to end organ damage, right? You start to kind of suffocate. Some patients need ventilators. You go into multi-organ injury, shock. Your heart starts to give out, and you can get really, really sick. The treatment for hantavirus is specific to what disease you have. So for Hantavirus Pulmonary Syndrome or Hantavirus Cardiopulmonary Syndrome, what we just talked about, it's really just supportive care. There isn't any magical medication. They've looked to see if steroids work, and they've shown to not be effective. They've looked at ribavirin, an antiviral, not effective. So it's really supportive care, right? Make sure they're not getting too much fluid, because that could leak out. Because those blood vessels are damaged, and just support the body and the organs while their body tries to fight this off. The other big type of disease hantavirus can cause is called hemorrhagic fever with renal syndrome, abbreviated HFRS. And this is also kind of a group of diseases. There's a lot of variability in what symptoms people have, but it also breaks down into 5 phases. Right? Phase 1 is the febrile phase. It's for about a week. And the symptoms you get here, remember, for hantavirus cardiopulmonary syndrome, that febrile phase was severe muscle aches, fever, fatigue, maybe some abdominal symptoms. For this version of hantavirus, you actually get flushing of the face, subconjunctival hemorrhage, where you start to get some blood in the whites of the eyes. AKI stands for acute kidney injury, AKI acute kidney injury, so you get some kidney injury, bradycardia, your heart rate gets slow. You start to get some petechia. These are kind of really small punctate bruises. It can happen in your mouth on your soft palate. It can happen in your axilla, your armpit. So it has some more defined symptoms, things that aren't necessarily common in other diseases. You then can progress to the hypotensive phase. This is where your blood pressure drops, your heart rate goes up. A third of patients go into shock. And this can last for hours, sometimes very brief, or days. Sometimes you get really sick. And this is where the hemorrhagic part, right, we said hemorrhagic fever, starts to occur, because you can get bleeding from multiple of your different orifices. You can get bruising of the skin, hematemesis, which is where you're vomiting blood, epistaxis, which is nose bleeding, melena, which is pooping blood, hematuria, which is urinating blood, intracranial hemorrhage, which is blood in the brain. So you can get bleeding from multiple orifices, and it can cause you to have acute abdomen where your bowels stop working and they dilate, and you get what's called a paralytic ileus. And it can cause convulsions of the arms and legs too, so that you can get really sick from this. Less people do than for Hantavirus cardiopulmonary syndrome, but you can still get very sick for this. If you survive, this is followed by about a week of oliguria, right? Low urine output where you're not urinating. A lot of patients go into acute renal failure, ARF, acute renal failure, and need hemodialysis, HD. And you can get fluid on your body, fluid in your lungs. Anasarca is fluid in kind of all your subcutaneous tissues where you get a lot of swelling. Pulmonary edema is fluid in the lungs, and then shock. And then if you survive, you start to get this diuretic phase where you're just urinating a huge amount, increase urine output for 2 to 3 weeks, so much that you can actually get really dehydrated. You have to be very careful and ensure you're getting plenty of fluids. And then this ends up in a convalescent phase that lasts a lot longer than the convalescent phase from Hantavirus cardiopulmonary syndrome that we talked about above. It can last 3 to 6 months. You get really slow recovery of your kidneys. So this is really serious too. Now the mortality is less serious, and you don't often see this in the USA. This is what you usually see in Europe, okay? So you often see hemorrhagic fever with renal syndrome in Europe, and you often see Hantavirus cardiopulmonary syndrome in the US. Again, just because they're caused by different subtypes of hantavirus that are more common in different areas. The treatment for this is supportive care, but ribavirin, the antiviral that does not work for Hantavirus cardiopulmonary syndrome, does work if you started early for this hantavirus, hemorrhagic fever with and renal syndrome. So early ribavirin does work for this subtype, the type that's most often in Europe, but it does not work for Hantavirus cardiopulmonary syndrome, the subtype that's most often in the USA. But you have to start it early here, or else it loses its efficacy. So how do we diagnose hantavirus? Well, remember, we said the incubation period is really long, anywhere from 1 to 8 weeks. So the most common way to diagnose hantavirus is through serology. This is where you take a sample of blood and you send that blood to test for antibodies against hantavirus. And the reason the incubation period matters is because it takes the body a minute to start to produce antibodies. It doesn't produce them in just one day. But since this incubation period is so long, you'll see IgM. These are antibodies that are produced first, followed by IgG, which are produced later. So this is the most common way to diagnose hantavirus. Now, you can do PCR tests for hantavirus and all that kind of stuff, but most common it's serology. And whether there's more IgM or IgG can sometimes give you a hint of if you got it super long ago or more recent, right? This IgM goes up early, IgG goes up later. But yeah, serology. And then preventing hantavirus is really rodent mitigation strategies, right? If you're in an area with a bunch of signs of rodents, maybe wear a mask, don't breathe all of it in, especially if you're in a high-risk area. Stay away from all that stuff if you're able to, and if you can't, at least wear a mask so that you're not inhaling it. So rodent mitigation strategy is the biggest thing. All right, hopefully that was a nice review of diving into all things hantavirus. Again, this pops up a couple times a year. It's currently in kind of all over the news cycle, so it's always nice to further understand it and the risks and all that kind of stuff. We hope nobody has hantavirus or has had hantavirus, but if you have, we actually have never seen a patient with hantavirus, so we'd love to hear about your experience if you're comfortable sharing it in the comments. Either way, check out the page, subscribe, hit the bell button, check out our Patreon page. We actually will post this video outline to our Patreon page. And either way, stay well, keep learning, and we'll see you all next time.